Fundamental of Nursing Chapter 23 Legal Implications in Nursing Practice. A homeless man enters the emergency department seeking health care. The healthcare provider indicates that the patient needs to be transferred to the city hospital for care. Which law does this action most likely violate? A. Health Insurance Portability and Accountability Act (HIPAA), B. Americans with Disabilities Act 8, C. Patient Self-Determination Act (PSDA), D. Emergency Medical Treatment and Active Labor Act (EMTALA). Answer D. Emergency Medical Treatment and Active Labor Act (EMTALA). Rationale. The Emergency Medical Treatment and Active Labor Act (EMTALA) requires that in an emergency situation, the patient must be stabilized before a transfer is appropriate. Health Insurance Portability and Accountability Act (HIPAA) addresses privacy issues. The Patient Self-Determination Act (PSDA) addresses a patient's right to refuse treatment and formulate advance directives. And the Americans with Disabilities Act 8 deals with equal access for all individuals. The nurse is preparing to give cardiopulmonary resuscitation (CPR) to a patient with cardiac arrest. The healthcare provider orders the nurse and code team to avoid resuscitation the patient. Which is the most appropriate reason for this? A. The patient is unlikely to benefit from CPR. B. The patient does not have a written order for CPR. C. The patient has given a do not resuscitate DNR order. D. The patient's family has not yet given the consent to resuscitate the patient. Answer C. The patient has given a do not resuscitate DNR order. Rationale. According to the healthcare law in the United States, cardiopulmonary resuscitation (CPR) is to be given to all appropriate patients unless the patient has given a do not resuscitate DNR order. CPR has been known to be very effective in reviving patients with cardiac arrest. There is no written order required for performing CPR. Performing CPR is based on the patient's condition. The healthcare provider or the nurse need not obtain consent from the patient's family to give CPR. An 8-year-old girl is brought to the emergency room with severe abdominal pain. The nurse has to get consent before medical treatment can be started. The parents of the child are divorced, and the mother has custody. The patient is accompanied by her mother, father, and elder sister, who is 19 years old. Who should sign the consent form of the patient? A. The patient's father. B. The patient's sister. C. The patient herself. D. The patient's mother. Answer D. The patient's mother. Rationale. When the patient is a minor, consent is given by parents or guardians. In this case, the parents are divorced, so the consent is given by the parent who has custody of the child, the mother. The nurse stops to help in an emergency at the scene of an accident. The injured party files a suit, and the nurse's employing institution insurance does not cover the nurse. Which would probably cover the nurse in this situation? A. The nurse's automobile insurance. B. The nurse's homeowner's insurance. C. The Good Samaritan laws, which grant immunity from suit if there is no gross negligence. D. The patient care partnership, which may grant immunity from suit if the injured party consents. Answer C. The Good Samaritan laws, which grant immunity from suit if there is no gross negligence. Rationale. The Good Samaritan law holds healthcare providers immune from liability as long as they function within the scope of their expertise. Automobile and homeowner insurance would not cover the nurse in this situation. The patient care partnership may grant immunity from suit if the injured party consents, which is not the case in this The nurse wraps and ties a cloth to prevent bleeding from the site of injury for a patient who is a victim of a traffic accident. The patient is taken to the hospital and presents with signs of infection. Which action will be taken against the nurse? A. The nurse will not face any action. B. The nurse will be given a warning for gross negligence. C. The nurse will face liable charges for not getting an informed consent. D. The nurse will be sued for not obtaining orders from the primary healthcare provider before intervening. Answer A. The nurse will not face any action. Rationale. The nurse has wrapped a cloth to control bleeding in the patient, thus providing appropriate care at the accident site. The nurse cannot be blamed for the patient's infection because the infection could be due to many reasons. The nurse has not shown gross negligence in this case. The nurse does not need informed consent in the case of a life-saving emergency, nor does the nurse need an order from the healthcare provider before intervening in this case. The nurse is studying the Emergency Medical Treatment and Active Labor Act. What is the meaning of the term patient dumping? A. Transferring a patient from a private to a public hospital on patient's request. B. Transferring a patient from a private to a public hospital after the patient is stabilized. C. Transferring a patient from a private to a public hospital on consent of the healthcare provider. D. Transferring a patient from a private to a public hospital without appropriate screening and stabilization. Answer D. Transferring a patient from a private to a public hospital without appropriate screening and stabilization. Rationale. Patient dumping refers to transferring a patient from a private to a public hospital without appropriate screening and stabilization. The Emergency Medical Treatment and Active Labor Act was established to reduce the incidence of patient dumping. According to this act, patients can be transferred from a private to public hospital on their own request after being stabilized or by consent of a healthcare provider. A patient is brought to the hospital after a motor vehicle accident. Which law makes it mandatory for the healthcare facility to provide emergency care to patients before transferring them to other hospitals? A. Good Samaritan Law. B. Mental Health Parity Act. C. Americans with Disabilities Act. D. Emergency Medical Treatment and Active Labor Act. Answer D. Emergency Medical Treatment and Active Labor Act. Rationale. The Emergency Medical Treatment and Active Labor Act states that a patient who is brought to the emergency room of any hospital should be stabilized before being transferred. The Good Samaritan Law protects people who provide help or first aid to victims with good intention. The Mental Health Parity Act forbids health plans from placing lifetime or annual limits on mental health coverage. The Americans with Disabilities Act protects the rights of people with physical or mental disabilities. The nurse notes that the healthcare unit keeps a listing of the patient names at the front desk, an easy view for healthcare providers to more efficiently locate the patient. Which does this action violate? A. Mental Health Parity Act, MHPA. B. Patient Self-Determination Act, PSDA. C. Health Insurance Portability and Accountability Act, HIPAA. D. Emergency Medical Treatment and Active Labor Act, EMTALA. Answer C. Health Insurance Portability and Accountability Act, HIPAA. Rationale. The privacy rule of the Health Insurance Portability and Accountability Act, HIPAA, requires patient information to be protected from unnecessary publication. The Mental Health Parity Act, MHPA, addresses the needs of the mental health patient. The Patient Self-Determination Act, PSDA, addresses a patient's right to refuse treatment and formulate advance directives. and the Emergency Medical Treatment and Active Labor Act (EMTALA) ensures appropriate screening and stabilization of the patient in an emergency setting. A newly hired experienced nurse is preparing to change a patient's abdominal dressing and hasn't done it before at this hospital. Which action by the nurse is best? A. Ask another nurse to do it so the correct method can be viewed. B. Check the policy and procedure manual for the agency's method. C. Change the dressing using the method taught in nursing school. D. Ask the patient how the dressing change has been recently done. Answer B. Check the policy and procedure manual for the agency's method. A 17-year-old patient dying of heart failure wants to have his organs removed for transplantation after his death. What action by the nurse is correct? A. Prepare the organ donation form for the patient to sign while he is still oriented. B. Instruct the patient to talk with his parents about his desire to donate his organs. C. Notify the physician about the patient's desire to donate his organs. D. Contact the United Network for Organ Sharing after talking with the patient. Answer B. Instruct the patient to talk with his parents about his desire to donate his organs. An obstetrical nurse comes across an automobile accident. The patient seems to have a crushed upper airway, and while waiting for emergency medical services to arrive, the nurse makes a cut in the trachea and inserts a straw from her purse to provide an airway. The patient survives and has a permanent problem with his vocal cords, making it difficult to talk. Which statement is true regarding the nurse's performance? A. The nurse acted appropriately and saved the patient's life. B. The nurse acted within the guidelines of the Good Samaritan law. C. The nurse took actions beyond those that are standard and appropriate. D. The nurse should have just stayed with the patient and waited for help. Answer C. The nurse took actions beyond those that are standard and appropriate. A nurse performs cardiopulmonary resuscitation (CPR) on a 92-year-old with brittle bones and breaks a rib during the procedure, which then punctures a lung. The patient recovers completely without any residual problems and sues the nurse for pain and suffering and for malpractice. What key point will the prosecution attempt to prove? A. The CPR procedure was done incorrectly. B. The patient would have died if nothing was done. C. The patient was resuscitated according to policy. D. Patients with brittle bones might sustain fractures when chest compressions are done. Answer A. The CPR procedure was done incorrectly. A recent immigrant who does not speak English is alert and requires hospitalization. What is the initial action that the nurse must take to enable informed consent to be obtained? A. Ask a family member to translate what the nurse is saying. B. Notify the health care provider that the patient doesn't speak English. C. Request an official interpreter to explain the terms of consent. D. Use hand gestures and medical equipment while explaining in English. Answer C. Request an official interpreter to explain the terms of consent. A pediatric oncology nurse floats to an orthopedic trauma unit. What actions should the nurse manager of the orthopedic unit take to enable safe care to be given by this nurse? A. Provide a complete orientation to the functioning of the entire run. B. Determine patient acuity and care the nurse can safely provide. C. Allow the nurse to choose which mealtime she would like. D. Assign nursing assistive personnel to assist her with care. Answer B. Determine patient acuity and care the nurse can safely provide. While recovering from a severe illness, a hospitalized patient states that he wants to change his living will, which he signed 9 months ago. Which response by the nurse is most appropriate? A. Check with your admitting health care provider whether a copy is on your chart. B. Have you talked with your attorney recently about a living will? C. Your living will can be changed only once each calendar year. D. Let me check with someone here in the hospital who can assist you. Answer D. Let me check with someone here in the hospital who can assist you. A nurse notices that his neighbor's preschool children are often playing on the sidewalk and in the street unsupervised and repeatedly takes them back to their home and talks with a parent available. But the situation continues. What immediate action by the nurse is mandated by law? A. Talk with both parents about safety needs of their children. B. Contact the appropriate community child protection agency. C. Tell the parents that the authorities will be contacted shortly. D. Take pictures of the children to support the overt child abuse. Answer B. Contact the appropriate community child protection agency. A confused patient with a urinary catheter, nasogastric tube, and intravenous line keeps touching these needed items for care. The nurse has tried to explain to the patient that he should not touch these lines, but the patient continues. What is the best action by the nurse at this time? A. Apply restraints loosely on the patient's dominant wrist. B. Try other approaches to prevent the patient from touching these care items. C. Notify the health care provider that restraints are needed immediately to maintain the patient's safety. D. Allow the patient to pull out lines to prove that the patient needs to be restrained. Answer B. Try other approaches to prevent the patient from touching these care items. A patient with sepsis as a result of long-term leukemia dies 25 hours after admission to the hospital. A full code was conducted without success. The patient had a urinary catheter, an intravenous line, an oxygen cannula, and a nasogastric tube. What question is priority for the nurse to ask the family before beginning post-mortem care? A. Do you want to assist in bathing your loved one? B. Is an autopsy going to be done? C. To which funeral home do you want your loved one transported? D. Do you want me to remove the lines and tubes before you see your loved one? Answer B. Is an autopsy going to be done? Conjoined twins are in the neonatal department of the community hospital until transferred to the closest medical center. A photographer from the local newspaper gets off the elevator on the neonatal floor and wants to take pictures of the infants. What initial action should the nurse take? A. Escort the cameraman to the neonatal unit while a few pictures are taken quietly. B. Tell the cameraman where the hospital's public relations department is located. C. Ask the cameraman to wait while permission is obtained from the physician. D. Ask the cameraman how the pictures are to be used in the local newspaper. Answer B. Tell the cameraman where the hospital's public relations department is located. A nursing student has been written up several times for being late with providing patient care and for omitting aspects of patient care and not knowing basic procedures that were taught in the skills course 1 term earlier. The nursing student says, "I don't understand what the big deal is." As my instructor, You are there to protect me and make sure I don't make mistakes. What is the best response from the nursing instructor? A. You are expected to perform at the level of a professional nurse. B. You are expected to perform at the level of a nursing student. C. You are practicing under the license of the nurse assigned to the patient. D. You are expected to perform at the level of a skilled nursing assistant. Answer A. You are expected to perform at the level of a professional nurse. A nurse works full-time on the oncology unit at the hospital and works part-time on weekends giving immunizations at the local pharmacy. While giving an injection on a weekend, the nurse caused injury to the patient's arm and is now being sued. How will the hospital's malpractice insurance provide coverage for this nurse? A. It will provide coverage as long as the nurse followed all procedures, protocols, and policies correctly. B. The hospital's malpractice insurance covers this nurse only during the time the nurse is working at the hospital. C. As long as the nurse has never been sued before this incident. The hospital's malpractice insurance will cover the nurse. D. The hospital's malpractice insurance will provide approximately 50% of the coverage the nurse will need. Answer B. The hospital's malpractice insurance covers this nurse only during the time the nurse is working at the hospital. A nursing student in the final term of nursing school is overheard by a nursing faculty member telling another student that she got to insert a nasogastric tube in the emergency department while she was working as a nursing assistant. What advice is best for the nursing faculty member to give to the nursing student? A. Just be careful when you are doing new procedures and make sure you are following directions by the nurse. B. Review your procedures before you go to work, so you will be prepared to do them if you have a chance. C. The nurse should not have allowed you to insert the nasogastric tube because something bad could have happened. D. You are not allowed to perform any procedures other than those in your job description, even with the nurse's permission. Answer D. You are not allowed to perform any procedures other than those in your job description, even with the nurse's permission. Nursing is caring for a patient who states, "I just want to die." For the nurse to comply with this request, the nurse should discuss A. Living wills, B. Assisted suicide, C. Passive euthanasia, D. Advance directives. D. Advance directives. Answer D. Advance directives are written documents that outlay the patient's wishes should he or she become incapacitated. A student nurse employed as a nursing assistant may perform care A. As learned in school, B. Expected of a nurse at that level, C. Identified in the hospital's job description, D. Requiring technical rather than professional skills. Answer C. Circa identified in the hospital's job description. Student nurses should never perform a task that is not in the job description of the facility with which they work. You are about to administer an oral medication and you question the dosage. You should A. Administer the medication, B. Notify the physician, C. Withhold the medication, D. Document that the dosage appears incorrect. Answer B. Notify the physician if you find one to be erroneous or harmful. Further clarification from the healthcare provider is necessary. If the healthcare provider confirms an order and you still believe that it is inappropriate, use the agency chain of command to inform your direct supervisor. A patient has just been told that he has approximately 6 months to live and asks about advance directives. Which statements by the nurse give the patient correct information? Select all that apply. A. You have the right to refuse treatment at any time. B. If you want certain procedures or actions taken or not taken. and you might not be able to tell anyone at the time. You need to complete documents ahead of time that give your health care provider this information. C. You will be resuscitated at any time to allow you the longest length of survival. D. You might want to think about choosing someone who will make medical decisions for you in the event that you are unable to make your desires known. E. We will get someone who knows the state's guidelines to assist you in setting up your living will. F. If you travel to another state, your living will should cover your wishes. Answer are A, B, D, and E. A. You have the right to refuse treatment at any time. B. If you want certain procedures or actions taken or not taken, and you might not be able to tell anyone at the time, you need to complete documents ahead of time that give your health care provider this information. D. You might want to think about choosing someone who will make medical decisions for you in the event that you are unable to make your desires known. E. We will get someone who knows the state's guidelines to assist you in setting up your living will. A nurse is teaching the staff about professional negligence or malpractice. Which criteria to establish negligence will the nurse include in the teaching session? Select all that apply. A. Injury did not occur. B. That duty was breached. C. Nurse carried out the duty. D. Duty of care was owed to the patient. E. Patient understands benefits and risks of a procedure. Answer B and D. B. That duty was breached. D. Duty of care was owed to the patient. Certain criteria are necessary to establish nursing malpractice. 1. The nurse defendant owed a duty of care to the patient plaintiff. 2. The nurse did not carry out or breach that duty. 3. The patient was injured. And 4. The nurse's failure to carry out the duty caused the injury. If an injury did not occur and the nurse carried out the duty, no malpractice occurred. When a patient understands benefits and risks of the procedure, that is informed consent, not malpractice. A patient's condition is slowly deteriorating. What actions should the nurse take to provide the best care possible? Select all that apply. A. Allow the nursing student to receive verbal orders from the physician in the room while the nurse is in the medication area down the hall. B. Document the patient's status changes in the medical record in a timely manner. C. Document that the health care provider has been notified of the specific patient status, including date and time that messages were left. D. Check the chart for frequent orders. E. Omit charting what the health provider's responses to notification of the patient's status change. Answer B and C. B. Document the patient's status changes in the medical record in a timely manner. C. Document that the health care provider has been notified of the specific patient status, including date and time that messages were left. The nurse hears a physician say to the charge nurse that he doesn't want that same nurse caring for his patients because she is stupid and won't follow his orders. The physician also writes on his patient's medical records that the same nurse by name is not to care for any of his patients because of her incompetence. What components of defamation has the physician committed? Select all that apply. A. Slander. B. Invasion of privacy. C. Libel. D. Assault. D. Battery. Anwar and C.A. Slander. C. Libel. A nurse gives an incorrect medication to a patient without doing all of the mandatory checks, but the patient has no ill effects from the medication. What actions should the nurse take after reassessing the patient? Select all that apply. A. Notify the health care provider of the situation. B. Document in the patient's medical record that an occurrence report was filed. C. Document in the patient's medical record why the omission occurred. D. Discuss what happened with all of the other nurses and staff on the unit. E. Continue to monitor the patient for any untoward effects from the medication. F. Send an occurrence report to risk management after completing it. Answer A and FA. Notify the healthcare provider of the situation. E. Continue to monitor the patient for any untoward effects from the medication. F. Send an occurrence report to risk management after completing it. The nurse calculates the medication dose for an infant on the pediatric unit and determines that the dose is twice what it should be. The pediatrician is contacted and says to administer the medication as ordered. What is the next action that the nurse should take? Select all that apply. A. Notify the nursing supervisor. B. Check the chain of command policy for such situations. C. Give the medication as ordered. D. Give the amount calculated to be correct. E. Contact the pharmacy for clarification. Answer and A. Notify the nursing supervisor. B. Check the chain of command policy for such situations.